Knee injections. Now, I'm just going to cover 3 of the basic types of knee injections that we do here at the clinic. So everyone is familiar with the steroid injection. So with the steroid injection, this really is more for pain control or inflammation control. So in the situation where a person has knee arthritis, there will be, yes, the person will experience pain and there will be inflammation in the area. Now, when there's inflammation around the knee, there are certain chemicals that are released or that are present in that inflamed area, and these stimulate the nerves, and then the brain interprets this as pain. So what the steroid does, it brings down the inflammation in the knee joint, and then the person has the experience of less pain. Now, in terms of the steroid that we typically use, and there are a few that you can use, we normally would mix tricort with some lidocaine in the same syringe, and this is what would normally be introduced into the knee joint or into the joint capsule. So I'm just going to show you a bit of an x-ray. Now, in this knee x-ray here, this person does have knee arthritis. What you can see, there's definitely some cartilage wear and tear over there, and also as well, there should be a space between the thigh bone and the kneecap or the patella, which you don't see in this case here. In a case like this, this person would benefit from steroid injection. Also, additionally, we will talk about 2 different other types of injections: the PRP, platelet-rich plasma, and the gel or the hyaluronan. And this knee joint is also a candidate for those other 2 types of injections. But I just want you just to appreciate how the arthritic knee looks and what are some of the features that we look for on a knee that has arthritis. And when we perform the injection, it is within the space here that the steroid goes. Steroid goes into the space here, or we can come from another angle and introduce it into the space over there. So now we are moving on to PRP. What PRP stands for is platelet-rich plasma. Now, how do we obtain PRP? What we do, the person who is coming in for the PRP, we have to draw about 10 milliliters of their own blood from the elbow here, and that is put into a centrifuge. We put the blood into a tube, and it is then put into a centrifuge. This is a sealed packet that will have a fairly large test tube in here that has a gel in there too as well that helps to separate the blood cells from the plasma. This here is a centrifuge that we will use. The tube will go in there, and then a counterbalancing tube on this side will be placed. It's put into the centrifuge and spun down for 10 minutes. And this is what creates the 2 layers, the bottom layer with the cells and the top layer with the plasma. The plasma is pulled up into a syringe out of the test tube, and then that is injected into the knee joint. Where platelet-rich plasma is concerned, you cannot have what is called bone-on-bone arthritis. There must be some cartilage for the PRP to work with. So I'm going to show you an example of what we would call bone-on-bone and where we would not really use PRP for. In this situation here is a bit more severe arthritis than the previous shot that I showed you. And as you can see here, there's far less space here. So this would be classified as bone-on-bone. There are also some spurs there that are growing in this picture of arthritis. Moving to the kneecap as well, you can see that there's significant wear and tear of the cartilage. There's really no space between the thigh bone and the patella or the kneecap. So in this situation here, I would not even consider PRP. Steroid may give some short-term relief in a person like this, but know that steroid is not to be given in people with uncontrolled diabetes or high blood pressure. Also, the 3rd type of injection, or the gel injection, may be a candidate. This person may be a candidate for that, although the relief may be short-lived. Okay, but I just want you to appreciate how a severe bone-on-bone arthritis looks on the x-ray. The 3rd type of injection would be the gel or the hyaluronan. Now, the reason I drew this chicken here, it is that the gel or the hyaluronan is made from the combs of the chicken. So what is the principle upon which this works? So what happens here, it is that the gel itself, it is a replacement for the synovial fluid. Right? Now the synovial fluid, that is the lubricating fluid that is in the knee. When a person is healthy, it has a gel-like consistency. It helps with lubrication and support of the knee joint. Now, as a person gets older and the picture of arthritis sets in, the synovial fluid is going to become more watery. It's going to have less volume. So now the lubrication of the knee is less. And then on top of that, you have less cartilage. So what the gel seeks to do is to be a replacement for the synovial fluid. And then what happens is, now this doesn't work as quickly as the steroid. When a person comes in and they do a steroid shot, within 5 to 10 minutes, okay, a person can report a significant reduction of pain. And everybody, of course, it all depends on the initial severity of the pain the person was having. But generally, maybe 70 to 80% of people will report within 5 to 10 minutes a significant reduction in the pain. The gel or the hyaluronan will not work that quickly. Give it about 2 to 6 weeks for a person to really begin to feel the effects of the gel. So now, once a person is not uncontrolled diabetic or uncontrolled hypertensive, what we can do right after the gel injection is given, a little bit of steroid can be put into the knee on the same day. So with the steroid, the person can get some more immediate relief while waiting for the gel to take effect. So where the gel is concerned, how we would do it here particularly, for the knee will receive a total of about 6 milliliters of the gel. However, we would break it up into 3 2 milliliter shots, as it may be easier on the knee to inject 2, 2, and 2, 1 week apart, as opposed to coming in and doing the entire 6 mils in the same session. Every doctor is going to have his or her preference. This is how we tend to do it here at the office. So the person will come in and they will take the first 2 milliliter shot of the gel. With the first shot, then we may include steroid as well. This is only on the first shot. Next week when you come, the next 2 mils, no steroid. Third week, 2 mils, no steroid. In terms of the dosing or the scheduling of the gel, it is similar with the PRP. With the PRP, you need to do 3 shots spaced 1 week apart. But with PRP, no steroid at any point is given. Then you tend to defeat the purpose of the PRP. So that is the difference between the gel. A couple of differences between the gel and the PRP. The gel is made from chicken. The PRP, you draw out your own blood, put it in a centrifuge. The scheduling is more or less the same, but with the gel, you can give steroid. With the PRP, you don't give steroid. You don't have to take steroid with the gel. You can choose to say, you know what, I prefer just to do the gel alone. I don't want to do any steroid, and that is fine. You can also have that option. In terms of pain, yes, we are injecting into the knee joint, so there will be some degree of pain when doing the procedure. However, we do take some measures to minimize pain. So this here is a freeze spray. Okay. And what happens is when a person comes in and they do the injection on the skin, we can inject some lidocaine on the skin before putting the needle directly into the knee. Or additionally, we can use this freeze spray. You can see it sprays here, and it will make the skin cold, and then the skin just turns white there. It gives me about 30 seconds to play with, where I can put the needle in and you would feel minimal pain. I'm not saying you're not going to feel any pain at all, but the freeze spray can make the experience a lot better for a lot of people. Okay, so we do take measures to minimize pain. And okay, so I hope you really enjoy this. I hope you are more enlightened about the different types of injections, exactly what goes on here at the office. So if you're having knee arthritis, knee pain, you can give us a call. You can speak to a doctor on the phone. If you need knee x-rays, we can write an x-ray script for you, send it to you via WhatsApp. A lot of places these days would take a picture, would accept a picture of the script. If not, you can come in and collect the physical script. You can speak to a doctor here over the phone, discuss your x-ray. Some places do digital x-rays, and what they can do, they can email us the pictures as well as the report, so we can take a look at that even before you come physically into the office, and we can advise you accordingly. Okay, so we hope to hear from you, and thanks.